Hello, and welcome back to another amazing episode of Denhta. Hi, how are you? My name is Lamoureux, and we have a special 5-part series that we are doing with CBRC, the Two-Spirit program, specifically with the knowledge seekers. And today, my very special guest is Mitchel Bowers, also known as Simma Downe.
Thanks for having me back.
And I'm excited for you to be here.
I'm so excited to be back. I guess I should introduce myself.
Yes, please let us know a bit about yourself.
Yeah, so Mitchel or Simma, use all pronouns. I am the executive director of Wood Buffalo Pride. I am Métis, member of the Métis Nation of Ontario with ancestral ties to Moose Factory, but I've been here in Treaty 8 territory for the past 13 years now. And I'm also drag persona Simma Downe.
It's crazy when you think about 13 years, because I was also thinking about when I met you in 2016 or 2015.
17.
Was it 17?
17, yeah, because this is our 10th festival this year.
Then I must have met you before.
No, we met at the first, like we chatted before the first festival, but we met at the first one. Was first time
That's right, because the first time I chatted with you, I was in Banff and you're messaging me about a show. So it's been 9 years since we've known each other, which is crazy.
It is almost a decade.
Almost. Where's the time gone?
It's crazy because we're only 25.
Exactly, right? When we're 15, just kids in high school,
Yeah,
keeping
exactly.
each other safe. All right, Simma, you joined us with Knowledge Seekers, which is a fantastic organization. Can you tell us a bit, program within the Two-Spirit program. Could you tell us about your experience with the Knowledge Seekers?
Yeah, for me, it's really been great of meeting community and being able to like have conversations around decolonizing research. But the biggest part, the best part for me has really been being able to every other week get to hop on line and get to chat with other Two-Spirit folks. I feel like living where I do, I don't get to have that community all the time. And so it's nice to just always have those to come together and be able to have really wholesome and good conversations, but also just feeling that community together.
That's one of the beauties of an online presence is that we get to connect with so many people across Turtle Island. Like you're Northern Alberta, which is fantastic. And then just having that connection of the differences in culture. It's like when we think of knowledge seekers, we have BC here, we have you there, then we had Manitoba, then we had the East Coast. There's just people coming from everywhere, and having that transfer of knowledge between us was pretty cool.
Yeah, it really was.
All right. Now, was there any specific reason that made you want to join Knowledge Seekers?
I think it really was just wanting that connection piece and wanting to be able to like see I can what we can build together that I can also take back to my community and see what we can bring up here in Northern Alberta and like help share those within community.
Nice. Do you have a specific highlight that you want to share about your time with us in the Knowledge Seekers?
The gathering in Montreal was so amazing. The first couple of days of the Two-Spirit gathering was so fulfilling and like just like really filled my cup. But also like getting to work with some of the elders and stuff was really great too.
It was really a great experience doing the Two-Spirit symposium there. And I've spoken with some other people, but the feeling of being in a room that is just Two-Spirit individuals is magic. And then also being in a room with Two-Spirit individuals with the aim of queer Indigenous research or working in programs to benefit Indigenous health is pretty awesome.
It really was.
Yeah. Do you want to tell us more about your experience while you're there with us?
Um, I don't know. Honestly, like it's funny. Like the memory that sticks out the most was actually just like a couple of us going for hot pot and just like getting to. And I know that's like not really a symposium. There was amazing teachings at the symposium. It was great to share, but like just getting to like hang out with people who you have such great connection with, and like that was, I don't know. I feel a lot of times in research spaces we don't talk about community, and the symposium was really filled with that community feeling, and that like there was a lot of care and compassion put into it. So yeah, that was the highlights for me.
But it is all about connections when we're in these spaces. It's not just about coming in there and transferring knowledge. Uh, it is that, but it's also the connections we make, the relationality of it all that we have. Because if we just went in there and it was top-down learning from us standing at the front of the stage talking to the room, I don't think it would have had the same effect as it would have had. The fact that we had all the rooms on circle tables and we made sure that everyone felt like they were a part of the conversation really exemplified Indigenous knowledge transfer.
Absolutely.
And like you said, those connections are important. That hot pot, not great, but the conversations we had around it
Conversation.
were great.
Exactly.
I think it was the worst hot pot I've ever had in my life. But did I still have fun? Yes, it was a good moment.
Yes.
But it's really true when you think about the connections we had there, because my main memories while I was there was the conversations I had with everyone. Just these moments of connection, because that's what's going to go with longer, and that's going to show the rest of the world that we're here for each other.
Absolutely. And we need more of
Yeah.
that. There's so much animosity and infighting sometimes within our own community that, like, when you come together with such good intention and community, it makes it all worthwhile.
That's right. No more lateral violence. Let's do some lateral love, lateral appreciation.
We'll get you some stickers and merch.
That's right. He has a sticker. I'll give it to you laterally. Okay. Our conversation topic that we have with you today is about healthcare. Would you like to tell us about access to healthcare in general within the Two-Spirit queer community?
A lot of queer people, if they're not able to be fully out with their service provider, so they might have access to a healthcare professional, but if they're not, don't feel comfortable coming as their full selves and being able to fully disclose what activities they're doing or what risks they're at, they might not be able to, if it's not actually adequate healthcare, if they're not able to share fully themselves with the doctor that they do have access to.
Yeah, and it's everything you said, and just the mistreatment that a lot of Indigenous folk has experienced within the healthcare institution, that it makes people have a distrust where they don't want to go back into it.
Yeah.
While you're talking, I just had a play in my head when I was in a community in northern BC, and this one person was talking about how they have an ailment and then they went into the hospital and he had a past injury that made him limp. And he was asked to wait in the waiting room for 3 hours so that he can sober up. But he just had a limp from a past injury. That he said that he would rather suffer in his pain instead of go back and be humiliated like that.
Yeah, I had a similar thing where I have a bad knee and I fell once and I hit my head and I literally was gushing blood out of my head. And it took me 6 hours of waiting to be seen. And when the doctor finally walked in, they're like, okay, let's see this knee. And I'm like, I know my knee's an issue, but I'm here to get stitches in my head. Like I literally need to be checked for concussion and to like, yeah. But yeah, they're just completely not listening to what the actual issue was that I was there to see.
No, and I don't want to say this was everywhere, but I feel like it's a common thread. As soon as people see Indigenousness in the hospital, they just instantly jump to alcohol,
Mm-hmm. Absolutely.
which is wild. So we need to change that with collecting stories.
Yeah.
When we did our health survey across Canada last year, we found out a bunch of information about Two-Spirit identities and how they access healthcare. It showed that 67% had primary healthcare from family doctors, 40% from walk-in clinics, 17% from nurses, and 11% from virtual/phone. You living as far north as you do you have any insight into that? Do you feel that those numbers seem correct?
Well, that is so, like, as far as having a primary care physician, that's 10 to 15% lower than the average Canadian. So that does line up. But I think here in particular, so we have Fort McMurray as like a rural service area, but then we have remote hamlets and communities outside of that. And many of those people don't have access. There are no doctors working really in those communities. Like Fort Chipewyan has a health center, but it's just nurses. There's no doctor there. And so that's a community that has to take an airplane or a boat ride or drive an ice road to get to a doctor. And that's expensive. And then also in a lot of our rural communities, if you don't have transportation, you're not getting access to a regular physician. Like you're only able to access emergency care. And that's, again, an hour drive or more. So I think in Indigenous communities, especially those remote communities, that we're going to see those numbers decline. And actually, probably if we were to further spread out this number more geographically, we would see that our rural participants have even lower access.
Yeah, and just thinking about Fort Chipewyan when you mentioned the ice road, that ice road still takes what, 5 to 6 hours
Yeah,
to
it's at
travel?
least 4 hours
At
to
least 4 hours.
yeah.
It's long. And then even if they have virtual or phone, call-ins, I bet those are scheduled, right? Be like, "Oh, that's gonna be on Monday at this time, so if you're sick on a Sunday, we'll s."
And is internet even how good is the internet access in these rural communities?
Mhm.
Like,
Yeah,
I know back in, where I'm from in rural Ontario, the internet is absolutely terrible. I'm like, they're doing, like, Starlink, and even then, it's yeah,
not the
a bad weather
greatest.
day can knock it out.
Yeah. Do you feel that adding the two-spirit identity into healthcare, it makes service a little bit more harder to attain? Not attain, maybe that's the wrong word, more uncertain to want to go in for care.
Yeah, I think we're talking about compounding and intersecting identities, right? So if you
Mhm.
take the issues that Indigenous folks have in accessing healthcare, like we talked about how like we get assumed to be drunk, we get like a lot of times they think we're just seeking pain medicine or whatever, like all of those, all the racism we face with Indigenous people. Then you add on being two-spirit and queer, and like we know we have higher rates of sex work. Are we actually being um talking to our healthcare providers about that and the risks involved and making sure we get treatment for those things? When we talk about our trans siblings, like are they um are they able to access healthcare? Are they going to get dead named? Are they going to get their pronouns respected? Are they like when I hear about stories from our trans siblings who are accessing healthcare and how atrocious things are and how inadequate our healthcare providers are towards trans folks, it is staggering. And when you are having these intersecting identities, you eventually just get numb to the fact and you choose to not attend, or you choose to avoid, or you choose to delay because the disrespect and the humiliation, the harassment you're going to face in these spaces is not worth it. Like
Mm.
I have a coworker who he's a trans man, so and he has received top surgery, and when going into a doctor for another unrelated thing, they saw his scars and asked if he had a heart surgery, and he's like, "This is from like a mastectomy. That's nowhere near the same surgical line as what a heart surgery would have. Like, how inadequate is this doctor that they can't even tell the difference between these types of procedures, right? Like,
Mhm. Yeah. It's crazy when they're not taking the time to learn about their patients, especially if you're coming into a space searching for help. You don't want to be dehumanized, you don't want to be demoralized, and not using their gender marker is insane to me when you are an institution that's there to help people be or get healthy.
well, I've seen as well a young trans man who was dealing with mental health issues. And when he's gone to the hospital at his absolute worst, like we're on suicide watch, they literally said, well, taking testosterone is making your emotions feel this way, which is, there's no science to back that up
No.
whatsoever. They just blamed his depression on his being trans,
Yeah. Which is crazy. It's
which
kind of like the same story where if there's anything wrong with you and you have a little bit of weight on your body, like, oh, if you lose weight, this will get better. Like, no, that's not it. Like this is my brain we're talking about right now. Like we need to figure things out. And it just feels like they're just trying to get people out treating you like a number. And I feel that's one of the worst things about the healthcare system is that it's an in and out system. Whereas with Indigenous people, we need that relationality. We need to be able to have that sense of comfort and connection and trust because we've been treated so poorly throughout history that now even going into a hospital can have a trauma response.
yeah.
Do you feel that as a two-spirit person or two-spirit people in general have more unique experiences when they're accessing healthcare?
Yeah, I think we experience that compounding, like I said, that compounding intersection of discrimination, of being queer and Indigenous. We're getting the issues, we're getting misdiagnosed, we're getting ignored, we're being or harassed or Yeah, all of the things. We're getting all of it, and we're getting it from two separate ways.
Mm-hmm. And we just need people to be more cool.
Take some sensitivity training and
Yeah,
actually put it into practice, not just something you just click through on your lunch break.
that's right. And to plug sensitivity and inclusive training, Wood Buffalo Pride has an amazing program that companies can take, right?
Yes, we can do virtual sessions too.
Yeah, but you also go into healthcare professions to do these trainings, right?
Yep, we do. We have a few that are certified with us, and we share resources from Foria and other affirming healthcare things. We have actually packages put together for our local healthcare providers to of everything they need to know to be more inclusive.
Amazing. I love that. Can you tell us of an experience when this is directed to you? You can choose to answer or not. It's up to you. But would you be able to tell us an experience with discrimination within the healthcare system?
Yeah, I actually have a really important story. It's not mine, but it is of a community member here. And they are a trans two-spirit individual. And they were 13. And they went to the hospital with because they were having mental health issues. And our hospital here does not have a pediatric psychiatric doctor. And so they prescribed this teenager um, an adult dosage of medication. This person is also a member of First Nation, and something that they get here locally and something that we have that our tribal council provides is wraparound supports when you're hospitalized. And so, what was available to them was actually to work with our local tribal council to have an aftercare program, so that when they were released from the hospital, they could have had support available to them. The hospital not only mistreated this person by giving them wrong dosages, they then released them without contacting the tribal council and pushed it through to go early to get them released on a weekend. And this person was dead within 24 hours after this because of the mistreatment they received. And I have right here in my desk, I keep their, I'm not going to show the front because it has their name, but I keep from their funeral, their program as a reminder of why we do this work and why we need better access to healthcare. We need it to be inclusive.
And it's like it's it sucks that we have to go or see these insane examples of discrimination for people to want to do change. I'm sure people have talked over and over again about these things happening, but no one listens. And then a death happens. And now people are like, oh, maybe we should have listened. And like, these are why we have our stories. This is why we talk about what we need to talk about. This is why we share. We're not just talking to talk, we're talking so that we can try to create change. And it's too bad about that person that unfortunately had to die because of mistreatment in the healthcare system for being a two-spirit trans person. And yeah, let's hope that doesn't happen again. Can I say that? And will it happen again? I'm gonna hope not, but chances are it might.
And honestly, like we're not seeing, like I try to start conversations with our hospital administration to like talk about the issues. And they had one meeting with me and they said they would come take our training to see if it's something they could offer to their staff. And they never have yet. Like they
Mm,
just, they took the one meeting and left and that was it.
yeah, and then in their books, they're like, "We did it."
Yep. We
Like,
talked,
no,
we heard them. That's all.
yeah. Thank you for sharing with us that with us, Simma. That was a very strong example of healthcare system failing us as a people. I have a small story that's not as intense, but it happened to a friend as well, where it just shows that the doctors are not paying attention to who they are when they're in their table. They're a trans woman and they were there to get a checkup. And the first thing he asks her is, when was your last period? And then it may have been gender affirming, but at the same time, they're like, you obviously aren't reading the paperwork. You're not reading the write up on me because you wouldn't say such a silly thing. Not as intense as yours, but still, it just shows that they are not treating people with respect.
Yeah. Similar vein. I know another trans man who was going for an appointment and, um, they asked him questions about like his gender and his sex, and he's like, and this the procedure he was getting did have to do with reproductive parts. So he's like, what do you need to, like, can you tell me what you need so that I can tell you what I have there so that I can like be very specific what I'm looking for? And the person just like kept yelling like male or female, male or female. And he's like this is a nuanced discussion for me. I've had some surgeries. Like if you're the what you're going to be looking at, and if like you need to know something specific, I need you to answer me what you're actually looking for and not just keep yelling male or female at me.
I feel like what you exactly said just really leads into our next question about experiences that limit our access to healthcare. And I feel that this person's response, without being able to know the nuances within sex, as a doctor himself, who should instantly know that biological
You're a
sex,
receptionist, but
receptionist,
oh,
sorry, sorry.
but it's full circle. Like it's full service from reception to nurse to doctor. They need to be able to answer basic questions.
Yes. And know these nuances about like expressive sex parts and the concept of gender, and it's just not being there. And then you're feeling like you're dehumanized. And that's definitely a limit to access to healthcare if you are a genderqueer person.
Yeah, absolutely.
Do you feel that there is any other experiences that we can chat about on that?
I think there's so many. Like every time that you go to a doctor's office and you get misgendered or have your dead name said, or that they make assumptions, and like every little assumption they make, every microaggression adds up to the point of you not wanting to access. And but it also, like, there's sometimes when it has dire consequences where they just choose to ignore things or blame things on something else. So any of these, like every one of these experiences, whether some of them are us then taking it back and being like, I don't want to go through this again, so I'm going to try to protect myself this way. But then there's other ones where it's just the healthcare system is fully failing, and it's like this. There's gaps and cracks that we fall through all the time because of the
Inadequacies and
inadequacies.
inadequacies.
It's a hard word. Inadequacies in the system.
We got there. But yes,
Yeah.
that's so true. And then you mentioned earlier, in essence, about us having to armor up going into a hospital. We shouldn't have to have that feeling that we need to protect ourselves or put a sense of armor on to go into a healthcare professional's office.
Yeah.
There is so many people that are from a non-marginalized group where they talk about being able to go into these spaces and have no issues, and then they say comments like, I don't understand why you're having an issue with that. And I was like, that's because the system is made for you and it was made for you to easily go through. We are not saying to get rid of it. We're asking it to change it to include us so that we can also go into these spaces and feel seen and feel safe and not having to feel like we need to put on a metal armor to protect our mental health going into a space that may be for to help us with our mental health.
Yeah. Locally here, they're transforming one of our wings into being an Indigenous centered healing wing or floor, whatever it is. And they like approach us for consultation. They're like, yeah, I want to make sure that's inclusive of Two-Spirit. And I was like, okay, like here's what you need to do. Like here's some practices, here's our resources. But if they don't actually take the time to train the people to actually be trans inclusive and queer inclusive, then putting in a TP and Indigenous art and having a smudge circle isn't actually going to get us anywhere. Like it's one of those things where they're like only going 50% of the way.
Yeah. I always tell people taking these courses is only step one. You know, you now need to take what you learn and put it into action, and you will still probably make mistakes, but you need to have the humility to be able to be like, hey, this happened. Where did I go wrong? And if you are still an access point, you can be like, okay, let's go back to on this course that we did. And then they can rework it so that it fits into their frame mind about how they made a mishap. And it's always, I'm hoping it will stop one day, but it's always ongoing. Learning's always ongoing. We're going to make mistakes. I'm going to say mistakes sometimes with regarding to gender. And I know that I do make mistakes, but I instantly apologize and move along. Because I've learned really quickly that if I say a gendered word wrong, apologize, go on, don't make a big deal of it. And I was like, all right, unless they want me to, and then I will.
Yeah.
But we're always learning.
Yeah, and something I always tell people too, that if you do misgender somebody's, like, yes, apologizing is fine, but another thing you do is thank somebody for giving you the grace and say thank you for giving me the space to learn and to improve myself too. And sometimes that can feel better than always being like, oh, I'm so sorry, because sometimes apologies just feel empty.
Yeah, totally. I'm empty. Just kidding. I get that because I say a lot of things on the mic, and sometimes my visualness of seeing something will say the gender out loud without realizing it. And then on the mic, I'll quickly say like, "Sorry, I shouldn't misgender someone." Then normally after the show, I'll go up and be like, "Hey, I apologize if that was inappropriate." And they're like, "No, no, no, you're fine. It's this." I'm like, "Good." Because I used to say all the time, and I still say this: it's not my responsibility to know your gender, but it's my responsibility to respect it after you
Yeah.
tell me. And that's 100%. It's easy to do for me to transition from he to they or she to they. It's no skin off my back. You, as a person, as a human being, I'm going to respect.
Yeah. Unless you're a barista with multicolored hair, I'm not necessarily going to know that you're a they, them right off the bat.
But I'm going to say they, them, and please correct me if it's wrong. I'm going to err on the side of caution. All right. Given that our bodies, our health studies found that 22% of Two-Spirit respondents had some experience with sex work. What are your thoughts on the intersection of sex work and discrimination in the healthcare system?
Oh, yeah. I think we, like I mentioned earlier, this is a higher rate than a lot of identities of participating in sex work, and it's such a stigmatized thing already. And it is, when it comes to healthcare, like, it's a vulnerable population that needs more robust access. They need comprehensive services, but a lot of times there's so much shame that we've put on it that a lot of people are scared to disclose that they are participating in sex work, and so they're not getting the treatment that they need and not protecting themselves as well as they could be. And so I think it's trying to destigmatize sex work so that people can feel comfortable to disclose it to their healthcare professionals, and then also have healthcare professionals not put the stigma back on themselves and actually be able to take it as a, like, a very in a professional way to be like, okay, this is how I can support you. Let's get you scheduled for regular testing. Here's some take home HIV test kits. Here's some extra condoms. Here's this, that. Let's make sure your vaccines are good. Here's some doxy prep. Like, there's so many things that healthcare providers could be doing to better support sex workers. But I think the biggest thing it just comes down to is reducing the stigmas, and so that A, sex workers can disclose it, and B, that healthcare providers can focus on harm reduction and providing services rather than um, adding that stigma.
I agree with that 100%. Let's destigmatize it. Let's normalize the conversation so that when people come into these situations, they feel comfortable and safe talking about it. We also just need to be able to talk about sex more. Like, we have this weird Eurocentric view on shame on sex, and we should be able to just have these more open conversations. And a lot of Two-Spirit people partake. They become sex workers. They do it out of a form of survival, and they create a lot of risky situations for themselves. But if we were able to destigmatize and have these conversations, they're more likely to talk to people about it and maybe limit or minimize these risky places that they put themselves in.
And it also leads into missing and murdered and exploited Indigenous people. Like, um, so many of those high risk people who are being murdered or disappearing are participating in sex work. And so, if we can actually destigmatize this so people can create better safety plans on top of just healthcare access, it's going to help that epidemic as well.
Mhm. Go- Going on what we just said, how do you feel we can challenge stigma and discrimination in healthcare?
I think we need to have open and honest conversations, and there needs to take the morality out of things like sex work. We need to have comprehensive training, not like I said, it can't just be little clicks, and it can't be just like once you're hired and you're good for the next 20 years. Like, it needs to be ongoing, continual learning. We need to actually have stories from community so that people can share their experiences of discrimination, so we can actually, like, get some empathy happening and get people to actually we need people from our community being in healthcare. The more of us that are there, like, it's so amazing when you like my doctor is a Métis woman, and it's so amazing having an Indigenous doctor who like I've never had such a positive experience. And like so having someone like you be your service provider is such a huge thing. And so yeah, I think it's just taking the shame out of things, having continual training, education, and having stuff made for us by us.
Definitely. It's we don't realize how much representation matters until we see it in front of us. Like you mentioned, having a Métis doctor with you and just you don't have the same experiences, but experiences parallel, and you're just able to connect on a different level. And then just having that in the room just makes you feel more, I don't want to say the word safe, but more susceptible to being open with them. Like that opens up the doors of dialogue a lot easier.
Yeah, it really does.
So we need to do that. We need to talk about things more. We need to destigmatize sex work. We need to get rid of the moralization of it. Get rid of your weird Christian views on sex, and let's just have honest conversations about it, so we can be more honest when we need help.
Yeah,
Or
and something sorry you just brought up about dechristianizing is like Alberta's actually pushing to put more healthcare money towards to religious hospitals. And so like that's actually further reducing people's access, people who are afraid of that morality and stuff and who aren't going to access the Christian hospitals. And it's crazy that our province is pushing funding that way and trying to further privatize healthcare.
Mhm. Well, everyone needs to go out and vote when voting time comes.
Yes.
All right, we're going to tie up our lovely conversations with you, Simma, but I have one final question for us. What do you think would make these spaces safer and more inclusive and accessible to Two-Spirit people?
I think investing in having Two-Spirit people be healthcare providers, creating more pathways for education for us, um, having, like I said, intentional and continuous learning and training, um, and making it mandatory. Like people being opted in and out of inclusivity training, it should be mandatory for anyone to become a doctor or a nurse to have to go through extensive inclusivity training. And it again needs to be refreshed every couple of years. It can't be some like a one and done. And it, again, that needs to be built by community members so that it's including their stories and their voices. And yeah, I think, um, and there needs to be better accountability. Like there was an instance here where multiple trans people had their health records accessed at our hospital, and months later they received a notice in the mail saying that somebody improperly accessed your file and took your information, but we fired them and that's it. But there was no investigation as to like what they do with it. And so these trans folks are
Wow.
like, am I going to be doxxed? Do I need to move? Like
Hmm.
what of my information was accessed? And yeah, again, we tried to approach the hospital to talk to them about it, and they were kind of just like, well, we can't talk to you about it because you're not the one that happened to, but just know but I do know personally one of the people this happened to. Sorry, I know we're supposed to be wrapping up, but I'm going on a tangent.
No
Uh,
worries. Chat
but
away.
yeah, it was very much like we don't care. All we're doing is this investigation. They no longer work here, but we're not actually going to look to see if your information went any further than that. We don't care about your
Totally.
safety.
We fired them, but they may still have everything.
Yeah,
Crazy. So we definitely need to have more inclusivity training, more people doing their proper work, their due diligence. Having said that, I'm going to bring it up again. Simma with Wood Buffalo Pride has an amazing inclusivity training course that if you want to take, and they just said on here that it's also virtual, so they can do it across Turtle Island should you need it. It's a fantastic course. I know that it's done by you and Brooke.
yeah. Brooke
Yeah,
is the training coordinator. Yeah.
yeah, who's also a fantastic, lovely human being. Simma, I had such a great time with you all. I always have great conversations with you. We used to have a podcast back in the day called Two-Spirit Tea.
Which
lasted
I really should repost those. They're not available right now,
it
but
lasted 3 seasons, I think.
yeah.
Yeah, and
One of them was really bad, where we tried to review Drag Race, but you didn't watch it first. So, but
it was really bad because I didn't do my part.
but that was your OG podcast. So
Yeah, exactly. I was very unprepared for what we're going in, and you came in with notes and your spreadsheets, and I was like, I'm here.
I feel like some of the conversations we had were really good. Like we had when we didn't talk about Drag Race, and we actually talked about good things. It was a lot of the similar conversations we're having now and that you're having with Denhta. So
We did.
yeah,
We did. It was the catalyst to make me realize I could do it on my own.
thank you.
Okay. Simma, you're a gem. You're a sweetheart. Make sure to follow her on social media at Simma Downe. She's a fantastic person, a huge advocate for her area. She also is an advocate just in everything she does with Wood Buffalo Pride, with who she is as a person, and then she travels around and creates light wherever she goes.
Yeah, fuck me.
Yeah. All right, Simma. I hope you have a great rest of your day, and thank you for being a part of this 5-part series.
Thanks for having me. I'll see you tomorrow.
Bye bye.
Bye.